time I feel that you're most going to get your child's attention is when they're sitting eating or when they're in the bath. So I'll say pick one of those times and make your child communicate with you.
Welcome to the Hey Mama podcast. We're your hosts, Tessa and Shayna. We are sisters, mothers, and doulas and are passionate about living an intentional life and all things motherhood. This podcast exists to create community as we learn how to delight in motherhood together.
Join us weekly as we chat with women about anything and everything from non-toxic living to women's health to feeding our families and our favorite topic of all, birth. We are so glad you're here.
Please keep in mind, the views of our guests may not necessarily reflect our own and vice versa.
This is not medical advice. We always encourage you to do your own research and make an informed decision. Let's get to it. Hello, and welcome to the Hey Mama podcast. We are so excited you guys are here today. Thank you for joining us. We are really, really looking forward to today's episode. We think it'll be really helpful and exciting and fun and all the things. But Tessa, before we get to that, how was your week?
My week has been good. It's going quickly. And again, don't know much what I did this week, but
a lot of momming.
And I have so many last minute Target runs that I keep having to go to.
Just you have to get popsicles for your impending birth.
My sweet husband went out. I had a Ralph's list and he tried to buy the popsicles that you recommended. He got two ones that were not it, so two wrong options. But they were both strawberry, which is the flavor I wanted.
Phew.
He's so sweet.
That's all that matters. Well, I might have led you astray, and Ralph's might not actually sell them. Oh. I've only bought them. The popsicles we're talking about, you guys, are the Alden brand strawberry popsicles. They're delicious, and they're all organic.
It's what got you through your birth.
It's what got me through my birth. No, I hadn't discovered them yet.
Oh.
Yeah, that's why I want you to have them for your birth.
This doesn't matter. We're going to end this conversation. Shayna, how was your week?
It was good. It was fun. It was great. There was nothing new to report on our end of the family spectrum.
Hey, that's all great.
Good. I cooked no new meals, nothing fun. Every time I tried to, me and Tess text each other what we're gonna make. Give me a little inspo. What are you making? Every time we're just not happy about it, but I'm making this.
Yeah.
We just got to get some more inspo, a little bit more half baked harvest.
A little more, exactly. We just need to flip through her pages of her cookbook. Well, anyways, we're so glad you guys are here. And today we actually have on one of my friends and co-workers, Kaitlyn, and she is an SLP. And we met through working at the same clinic, speech clinic. So happy that Kaitlyn is here today. And she's just kind of give us a little bit of insight and shed some light and truth on just kind of maybe why you might have an SLP in your life with some young kiddos. So, Kaitlyn, if you want to go ahead and introduce yourself and tell us a little bit about yourself.
Hi, everyone. Thank you guys again for having me. I'm so excited. So I am a speech language pathologist. I have been in my practice for 6 years now, but I didn't start out as a speech language pathologist. I started out as actually a child development specialist. So I would go in homes and work with kids 0 to 3, and I worked on all areas of development. So these kids were also getting other services, but I was kind of child development specialists are a little bit different because we're in home, we're in their most comfortable environment, speaking to them, speaking to parents and working with their child. I went and got my speech assistant license and then knew that I wanted to continue and grow. And then I got my master's in speech language pathology. So I worked mainly at an early intervention, the same private clinic I've been at again for 6 years. I also did one of my internships at a hospital where I live. So I got to work kind of with the medical side, the really fragile side, and then also early intervention. So I love what I do. I love working with kids. I never feel stressed about going into work. But in my spare time, I love cooking. I really like to cook hearty meals, but I make them really low carb or low calorie. So I'd like to be creative that way. I work out when I can. I play pickleball or I do cycling classes. And then I recently picked up on, I try to be. Recently, I picked up on reading, so that's it. Nothing too exciting. That's a little bit about me.
That's all exciting. We love pickleball or paddle tennis.
I remember that, like, meeting you early on, and that was like something that you're like, yeah, I'm gonna go play pickleball, and then tomorrow night I'm gonna do this, and the next, and I was like, what, this girl? And I'm like, I have nothing planned. Is that because I'm like just bored or like just unexciting? I don't know. Unwilling to try new things, but yeah, I was like, you've always been very active, so that's pretty cool. I like that.
I try to be. Thank you.
I love it. Well, why? So I think a lot of people, again, it's not something that a lot of people just know about. So being a speech language pathologist, obviously there's, kind of some things that you could assume with that, but why might a family be working with you in the kind of early child development, like age, like in that 0 to 3 range? Why would somebody be working with you or need to work with you?
So you can see a speech language pathologist actually as early in the first few hours of life. And we had briefly spoke about this. It was about the lactation. So sometimes speech therapists or a board certified lactation consultant can work with your infant on sucking, if they're having a hard time latching to the nipple. So sucking, and again, that's swallowing with it. So, and then also sometimes parents have tongue or lip ties, with their children. So it's the first time that they're ever, what's a tongue tie? What's a lip tie? All of that has effects on the child swallowing, which can or can't lead to speech delays later on in life. So that's something where a speech therapist could be needed extremely early on. But the majority of population that I work with is right around 20 months, because we want our kids to start saying first words between 9 and 15 months. So we want to look at their babbling. Is your infant babbling? Are they cooing a lot as a child? Are they looking at you in the eyes? Are they smiling? All of those are early precursors to language. They're all early developmental stages. But again, a first-time parent doesn't know that cooing is important or babbling is important. So usually they'll go to their pediatrician, and their pediatrician will 9 times out of 10 ask, is your child talking? Are they understanding, simple directions? And that might be the parent's first time of like, wait, they're not talking. Are they supposed to be talking? So I see a lot of kids working on just early language, play skills. So that's my most. So I do a lot of playing. And I always tell my parents, it looks like I'm playing, and I am, but I have a method to why I'm playing with them. So
exactly. Awesome.
Yeah. Playing is huge. I was going to ask you, talking about the lip tongue tie. My daughter had a pretty severe tongue tie where the tip of her tongue was tied basically to her jaw. So she couldn't suck or swallow correctly, right? So we had to take some actions on that. And I just wanted to see kind of with that potentially having that delay, what do you kind of recommend for children that maybe you see them at 2 years old and you do notice that there is maybe some sort of oral restriction? How do you kind of go about that process? Sorry, I know that was off topic a little bit, but I was just interested in the moment.
Oh, no, I find that so interesting that you asked that, because I deal with that quite often. I'm not a doctor, but if it were my child and they had a tongue or lip tie, but it wasn't affecting their latching or swallowing, oral activity, I would still clip it. That's just my opinion, because it can now lead to later developmental speech sounds that a child's supposed to have. It can lead to a delay in that. And now, even though your child is swallowing and chewing their food greatly, they might have a speech delay at 3, 4, 5 years old now. So now it's going back to either the pediatrician or the dentist, getting it. They clip it now or they laser it now. So
yeah,
that would be my recommendation.
And with Shayna, because you actually did have it lasered in the early, like it became a thing.
3 days old.
Yeah.
4 days old. Yeah.
Are you seeing any correlation with that? So let's say they were released as an infant, right? And then around the 2 to 3 age, range, are you seeing any correlation with delays, or if it's been kind of dealt with appropriately from the beginning, is it something that you're not really seeing delays as much with? I don't know if you've seen that correlation yet.
I have. So I have a few clients who will always ask a case history, did your child, was there any medically, things that were significant during the birth or pregnancy history. And then, we'll ask, did they have a tongue or lip tie? And they'll be like, oh yeah, they did. And they'll say, yeah, we got it clipped. The children who I see now that have not gotten it clipped, they're around 3.5, 4 years old. And it's something that we recommend. So I look at the sounds, for instance, raising your tongue to the roof of your mouth for sounds like T's, D's, N's. They're not saying those T's, N's, or D sounds. So let's say like a word like hat, they may say, oh, put on your hat, but they don't understand that they're not, so I would really, really recommend then seeing it. So I have seen a correlation of parents not getting it clipped and then what it's doing in later developing sounds. And then for my kids who mostly have gotten it clipped as infants, I don't see many speech errors. So it doesn't hurt to, like I said, not a doctor, but it doesn't hurt to get it clipped.
Awesome. Well, thank you for that. Yeah. I was going to say too, when it's just so cool because you're in that world of just this young range. What is the range of age that you typically are just seeing? Is it mostly that early childhood, like early developing?
It is. So I choose to work with early intervention just because 0 to 5 are the most crucial years for a child's brain development. And so we have like neurons in our brain, and they're basically like, it's like a freeway, and they just want to get through, but then we have to build them and we have to grow them. So I choose to work with 0 to 3, but like I said, I don't really work too much with the 0, with the infants, but like I said, right around that 20 to 24 months is where kids will start coming to see a speech therapist. Because maybe their parents, moms are looking at their play group, they're starting to compare. Your daughter is talking in at least 2 words. Mine isn't, or mine's not responding to their name. So I think 0 to 3 is a huge development era, and then up to 5. So those are our kids who truly need the most attention, and they're the greatest importance.
Awesome. So cool. And do you feel like, so I know, again, we're going to talk about it a little bit later, if you've seen kind of just an increase post like with 2020 possibly, and how that affected, and, a lot of these parents saying that they weren't able to have their children around other children, and that's kind of why. And are you like, how has that affected you with just COVID 2020, and then now looking at like, okay, development with these kiddos now that you're kind of dealing with now, because it's to 2023 and they're all about to turn 3, right? So just how have you seen that kind of play out with delays?
So I'm sure, just like you, Tessa, is at least we started saying we're starting to get our COVID babies. We call them our COVID babies because they're turning 3 this year. So they started coming to us last year when they were 2.5. So parents do say, it's my fault because we were at home. We had a lot of health issues in our family, so we didn't want to go out. And or like the masks, everyone's covered up with a mask now. So, and children need to look at your face. They need to look at your lips and your facial expression. So I do see a lot of, again, our COVID babies coming in. But I also see the rates of autism and that spectrum also growing. So I feel that as our generation just only prolongs and increases, is we are getting more kids, and the ratio to atypical versus typical kids is definitely declining. So a lot more kids are starting to be on the spectrum. So I see a lot of that in my recent years. Yeah.
That's hard. I mean, it's hard just to see that, yeah, something that was so out of all of our control right now is just affecting us in so many different ways. But yeah, I think it's such a common one. And again, just with, friends and peers and family members and people who've been dealing with just children with having speech delays or speech issues, and just whether or not going undiagnosed during this kind of transitional time, 2020 to 2023, I've just noticed a lot of that, of like an undiagnosed, because parents weren't taking their children to follow up with these specialists that they normally would be, right? Or they were getting delayed on it for a while. So it's just so interesting for that to kind of see how that played out as well.
Or they weren't noticing because you weren't around anyone else.
Exactly.
Or you can't hear because someone's wearing a mask and you can't hear what they're saying. So like, I know like a lot of kids would like be talking. I'm like, I don't really understand. Like, I need you to pull your mask down. I don't know what you're saying. And because that muffles the sound. So then they don't know how to project it. I mean, I'm not an SLP, you guys, but what I would presume of like,
you're right.
Yeah. Do you, and again with that, because I know we'll move on to the next question that we have for you, but are you seeing, I would say, any difference between diagnoses or just the children that are coming into the clinic in the last few years? Just any change? I know you said obviously an increase in autism and obviously an increase of just kind of that neurotypical to atypical, but are you seeing like similar, just like we just have a lot of kiddos with speech delays that are just kind of coming out of the woodwork or anything like that?
Yeah, we see a lot of we have a ton of kiddos with speech delays. I feel that, even 15 years ago, speech therapy was not as big and prominent as it is now. And I still feel like we are such a small field. There are not that many of us. And, but we have grown. So speech therapy was almost unheard of. I'm sure like our parents, it was just like, oh, very, very severe kids went to speech therapy. They were on the spectrum or had, underlying medical issues that required them to need it. But because I feel that we are growing as a field, we're allowed and able to take on more children. So it does look like our numbers have increased and we are seeing more kids. Parents will come in and we always ask, is there a family history? And usually they'll say, oh yeah, like my husband had, speech therapy. Oh, did he receive speech? No, he didn't. Or he just had a speech delay. Yeah, mom said he didn't start talking till 3.5. And then I'll ask, did he receive speech? No, he didn't. But now we have so many services that your child can receive speech, as young as 2. So I feel that because our field is growing, the amount of kids we see are growing.
Yeah.
That is a really good point.
No, that is a really good point.
Oh, are you trying to say more?
No, I was like that. I just think that's a really good point. Just the awareness of it. Of like, we do have, again, we always say like our poor parents, the baby boomers, it was a very grin and bear it. Everyone just figure it out. Everyone was okay. You just got through it. Life's hard. And then this generation sometimes is a little bit more like, oh, what's wrong? Right. So now, but we have everything at our fingertips.
And within the past, few years alone, like so much exclusivity. And now you don't have to be ashamed if your child receives speech. Because I still sometimes will have grandparents who are like, no, he's fine. But I'm just saying, we just help. We just help and we play and it doesn't hurt. It doesn't hurt. So sometimes we can see the older generation kind of being a little bit more bearing of it. And no, they're fine. But I always tell parents, this is not going to be tattooed on your child's forehead. It just helps. And it's a free service. And a lot of parents are so kind. I mean, I deal with amazing parents, so everyone's really understanding. And so that's what's so great about it too.
Yeah, there's almost like that stigma attached to it of like, oh, your kid's in speech therapy, like mine's not. Or like, like how a parent might feel like, oh, I take my kid to speech therapy, and then it's almost that shame. And you're right. Like, but if we can do something to better something, right? It's not even like if you can do something then to expand and develop and foster then let's do it. There's no reason not to, you know, like going back to like a tongue tie, like if there is something that can be done to then better a child's ever like their years, whatever it may be, we know there's links to behavioral things and sleep and all those different mouth breathing, all those things. It's like, if you're able to, and you feel like it's right, then you can do that if you're able to with the speech therapy and it's a free service. So yeah, that's amazing. That's such a good point. Well, thank you for sharing that. And we know just a lot of parents and mamas are sometimes concerned or maybe overanalyze sometimes their kids' speech and whether or not they are delayed. I'm saying that in air quotes. Could you give us some examples of what a speech delay might actually look like? And then what is just a typical developing baby's babble early language look like kind of that difference?
Yeah. So a speech delay can start, at around 3 months. So we want our child to be cooing. Those are those vowel sounds, oohs and ahs, babbling, mama, 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 pa, pa, pa. We want, syllables like that. But again, a first-time parent may not know. So again, they'll go to that pediatrician. And what's so amazing is the pediatrician hopefully will give the parents some parent education and send them out to whatever services are provided through their state. And all states do have services. For instance, in California, it's called the Regional Center. Refer them. And now it's up to the parents of, okay, should we follow through? And should we get an assessment? Again, parents may go in, half the time they go in blindly, because they don't know about it. They don't know if it's going to cost them, if insurance is going to pay for it, how often is it going to be. So parents come in with so many questions their first session. But typically, language delay, I'll see my client and I can suspect kind of my intuition of what I think how this, the route's going to go. But just, putting words together. If a child's hungry, I would love them to say eat. And then we work up to mama, eat. So now they're putting 2 words together and then they're going to tell you, mama, I want banana. So they're going to start simple and then they're going to work their way up to beautiful sentences. So my form of therapy, and I've followed this since I wanted to become a speech therapist, is always making my sessions as effective as possible. And whether that's if the child gets a word out, maybe he won't bumble. But my session will be effective if my parent is sitting there watching how I interact with their child. So now they can go home and interact that same way. In grad school, I wasn't taught how to play. They didn't put me on the floor with, a baby doll and cards and say, okay, Kaitlyn, this is how you're going to play with it. So we just know the background, but anyone can play. Anyone can get on the floor and be silly. So just exposure to any language. But that's kind of what I see is just the child communicating or following directions. If you take your hand, put your plate in the sink, we look at that. We want our child to follow a simple direction, make eye contact with us. So those are some of the big delays that I see is that no eye contact. If you giggle and smile at your child, we want them to giggle and smile back. So that's kind of a lot of what I'm seeing right now. It's just kind of getting their attention and keeping their attention.
And then I know you noticed, you said the play. Is there anything else that you like to maybe have parents implement at home while they're not with you? Maybe they come once a week. So are there things that you're having them implement or things that you might say hey, you could try this? So the playing and getting down on their level and looking them in the eye. Is there anything else like that you kind of encourage parents to do?
Yeah. So one of the main things that I always say play. And after play, I always tell parents to pick a time. I always say, because granted, we're all busy, so you don't have time to sit there and really have your child speak or try to do a sign language gesture 24 hours of the day. That's just not right. And something that's not functional. We can't do that. So the time I feel that you're most going to get your child's attention is when they're sitting, eating, or when they're in the bath. So I'll say, pick one of those times and make your child communicate with you, whether it be through eye contact. Eye contact is a form of communication. It doesn't have to be words. So I'll say, if they're sitting in their high chair, give them an option. I'll always say, do you want fruit snacks or do you want an apple? Give them a visual option and then have them look, at both options, and then maybe work on taking their finger to point. Ooh, I want the apple. Give them the apple and then slowly, take it away. Oh, do you want more? Sitting there for 10 minutes while your child eats will do more good than bad, versus just, here's the apple, here's the fruit snacks.
Right.
So whenever they want something, and children love food, bringing things to your eyes is what I say. I say that a lot, is bring the object to your eyes so they are now forced to look at you in the eye, and then once they point or maybe say for apple, beautiful. Give them the item so they know that when they use their words or hand gestures or eye contact to communicate, their needs are going to be met, and that's what we want. That's what's going to lessen the tantrums, lessen stress. So I would say that's what I tell all parents.
Yeah, and that's so good because that feels so tangible, right? That feels like, okay, I can do that. I'm already giving my child these snacks so I can, sit down and settle myself, and I'll eat the apple while my child is eating the apple. And I think that's beautiful, the way that you're able to kind of also tie in that connection point, because that's really right. The kids also just want that connection to their caregiver, to their parents. And so that's such a beautiful way that you're able to also implement and help them implement that. So yeah, that's such a good idea. Picking a time, bath time or food snack time. That's amazing. Yeah. I love that.
I was going to say I use the same times. Those are always my same ways that I always try to encourage my families. And I think I always say too, like, well, you eat 3 times a day, right? So these are simple ways that you could just start implementing. But yeah, giving the families an actual example is a really helpful way, because they feel lost. Like, where do I start? Like, I realized I wasn't talking to them when I said, open the door, open, open, open. Mama's going to pick you up. Mama puts you in your high chair. Ooh, buckle, buckle, right? And, all those things don't always come naturally, especially like you've been saying, as a first-time parent. And especially this post-COVID 2020 isolated world, you're not around other parents. You're not seeing how other people are interacting with their children. And so that's just such a good way of like, yeah, you got to do it multiple times a day. And this is one way to start, right? For that carryover. Because that carryover, as we know, is huge. We're not going to change the child by that 1 hour session that we get them for 1 week. Once a week. It's the parents that have to carry it over. So just giving them that tangible advice is huge and a good example. And again, I love that. Yeah, like Sheena said, it's just a simple way to do it. It's not like you have to now start playing for 3 hours a day on the floor with your child.
You have to have note cards. You have to have the color coordinated. You have to have them pointing to everything. And you're like, because they could do that. And I'm sure a lot of them will build up to doing a lot more stuff. But it's that simple application that is so helpful. And like what you said, everyone is busy, has busy schedules, full lives. And so it's helpful to not feel overwhelmed. Like, or a little reminder of like, that's right, I was doing that. And then I actually got busy and I forgot to sit and have a snack with my child. So then you're kind of helping them that way. That's great.
And so you said some of the markers that you might be looking for within a speech delay, just to kind of bring it back to that, or lack of eye contact, possibly, whether it's lack of imitation to a word when you say it, or just lack of words in general. Maybe it's not seen as much play, right? And that interaction. Is there anything else like that you're kind of seeing that would be little markers that maybe a parent listening might be like, okay, maybe that is something I need to kind of pay attention to. Are there other markers like that?
Yeah, so I would really, really look at early gestures. So gestures such as there's 16, to be exact, early developing gestures that a child does. That's a precursor to language. These gestures are simple as looking at you in the eye, 1, clapping their hands. If a child wants to be raised up, putting their hands up into the air as a gesture. When a parent says, "Come on," and they wave their hands, "We're going bye-bye," that's a gesture. So we look, does a child understand those gestures? So I would really, really look at all of these. Precursors is just a fancy way of like, language is coming next. So we want them to do these gestures, not sign language gestures in a way, but just how we can use our body to communicate without saying anything. Emotions. So if you do a scared face, do they do a scared face? Are they scared of your scared face? You tickle them and they laugh and giggle. And, they look at you like, "I want more, like, give me more of that." So I feel like, as a mom and as a dad, you guys know your child best. And, look at your child. Are they getting attention from you in a positive way? Or are they constantly crying? But yeah, eye contact, joint attention, looking at something funny and then turning their head to look back at you. Responding to their name. A child should know their name by around 9 months. So it's like, "Oh, I hear that name all the time. That must be me." So, sitting across the room, maybe, call their name and see if they look for you, or their mom's voice. They love the sound of their parents' voice. So, maybe hide and not scare them and sneak up on them, but say, "Hi, it's Mama," and see if they look at you and smile. Because they just love that. So facial expressions to me is an eye contact are the early stages of where I would hope a mom would and a dad would look and see, okay, let me see if they're doing any of that.
Awesome. That's super helpful. Do you feel like how important is sign language for baby, or especially even just baby sign in the beginning? Is that something you like to focus on?
I like to focus on it if I can tell from my clinical judgment if a child doesn't have the motor planning to say an actual word. Because a child will learn sign language just as we do language. So it's actually really, really interesting. If a child is deaf and signing, they're going to be signing between that 9 and 12 months, just like a hearing child would say their first word. So sometimes our kids like to be a little lazy, and it's like, "Oh, I'm just going to sign more. I'm just going to sign all done because I don't want to say it." So that's when I like to decrease my signs, because I want them, if they can verbally speak, I want them to verbally speak. But signing is 1,000% a form of communication. And I know that if a simple sign as more, eat, all done, is going to lessen the frustration between a child and parent, and they're going to get their communication needs met, then I will happily sign with them and teach them, simple signs, and teach the parents, again, simple functional signs. I don't expect anyone to become an interpreter. But just really at the end of the day, it's what's going to best fit the child and their needs and their communication. And if it's sign, then I will do that.
That's good.
You mentioned too, between 9 to 12 months, you kind of start wanting to see those first words come through, right?
Mm-hmm.
So, around 3, right? They would be possibly going to pre-K or something like that, or a state program or a school program. So when they turn 3, how many words is kind of like a goal for a parent? Like, what is that range?
We would love to have them over 400 to 500 words at about that time.
Okay.
But because of COVID, actually, it ended up being this whole thing is after COVID, I don't know who changed. I should know. That's pretty bad on my part. But someone changed how many words a child should have. And
the CDC,
I think
right?
the CDC or the WHO did.
Was it the CDC? It was
CDC,
one of
yeah.
them.
You're right.
Yeah, and a lot of therapists were mad because they're not certified speech language pathologists. So
Right.
that's upsetting. But anywhere, I like to explain to parents like this because they're not going to remember, oh, my child needs to have 75 words right now.
Right.
Let's think one word at 1 year old, 2 words at 2 years old, and then, you know, three, at least by 3 is when we should start getting more and more words. If your child has about 50 words, then they have enough words in their vocabulary to be putting 2 words together. So that's another thing that I look at. And parents love to see data. They love to see numbers in a sense. So I give my parents a little questionnaire. It has about 400 words on it. And I just say, circle all the words that they're saying. It may be 9. And then in 6 months, I'll retest them. And that 9 has increased to 20. And that may not seem like a lot, but to parents who have struggled with communication, you know, it is. So, so I just, very, very simple terms. You know, I don't speak professionally to my parents because they don't know. It's like a doctor speaking professional to, like, I know I would be lost because that's not my expertise and I don't understand that terminology. So I really have to speak in a way that my parents can understand. So I would say 50 to 100 that's an easy number to kind of get. But then again, 1 word by 1 year old, 2 words by 2, and then so forth.
Awesome.
Yeah, that's so great.
That is super helpful.
Yeah.
And again, just as I having a kiddo of my own, and just, it's just so cool, you know, that when they do get maybe that 1 word, that all of a sudden opens up their world to now request their favorite thing. Like my son knows banana.
Yep.
And when he got to say banana, it was like, first of all, I'm over here like, please stop saying that word. And please, why do you have to know what the banana looks like? And just ask for it 8 times a day, you know? But it's also such a beautiful thing because then now you're connecting with your child, and whether that's using sign language or gesture, a meaningful point that they never had before is just like these beautiful, like you're saying, eye contact is communication. I hear, like, that's something I say to my families all the time too, is just like, eye contact is them communicating with you. So even if in that moment they flicked back at you when they said, wait, stop, don't run away. And they looked back and they gave you eye contact, they understood that. And I get, you know, excited. And they're like, well, no, they disobeyed me. But it's like, no, that's just such a beautiful thing because they're understanding and they acknowledged you. Right. So it's so cool that you're able to kind of explain, these idiosyncrasies, these little tiny things that they might do are huge. They're huge things.
Yeah.
So,
and you have to think to a parent that never had a child with a delay. They're just, that's how my child developed, you know, but looking back and they could, wow, when we, you know, first started coming to speech, or, you know, 2 years ago, he wasn't even saying, you know? So now he's putting, like, he won't stop talking. That's what parents would say. So, it is there, you know, they may be many milestones. I think one of my favorite quotes is, day by day, nothing changes, but all of a sudden you look back and everything's different. And I just love that because parents, you know, come in and their child may be nonverbal and now they're verbal, or maybe 2 years later they finally picked up that sign to communicate. I mean, just something. So
so wonderful.
You do amazing work, and just you have to have such a heart. Well, but you're, you know, I never made it to your level. You're doing it. So it's just so cool just because your heart is so patient and so empathetic, and you just I believe it is a calling, and you have it, and you have a way with parents, and it's so neat. So I love that. As we kind of wrap it up here, is there anything, you mentioned the regional center as a resource that parents can look to, and pediatricians, and so if a pediatrician maybe didn't catch it, right, or maybe suggest for you to go forward for other resources, and then you said regional center. Is there anything else that's like that a parent could use as a resource to kind of maybe figure something out, or to go forward with testing, or anything else?
As far as right now, from 0 to 3, my best bet would say ask your pediatrician. And then from there, you know, we have the internet. So I was even trying to, you know, find more resources. But my best bet was just using the internet to our best ability. You know, we can Google anything, you know, speech services, you know, in LA, speech services, whatever city that you may live in. And you will see there's going to be, like I said, one main account, but from there, you're going to have someone, a caseworker, working with you. And they are so knowledgeable. I would also say free stuff in the public. And one of my favorite things is like the library. The library is free, and they have so many early developmental classes for your child. So they can even teach you, how to interact with your child. And from the library, they're going to give you so many resources on community events. And a lot of my parents find out, through friends, through mom friends. Oh, my sister's cousin went through the regional center. Try it out. So again, I know not some people may have that access to have, a group of mom friends, or may not have the necessities to travel to the library. But I would hope that every child has a pediatrician, and parents aren't ever ashamed or afraid to ask. If you suspect something, and you feel it in your gut, I'm not a mom, but I know that people say it's just a mom instinct. You just know. And so if you have that mom instinct, I would really, just try it. Asking questions is free. It's free.
Awesome.
And I've always said that asking for help is free. It may take roadblocks to get there. I know some people, a lot of people that just last week, I had a dad say to me, oh, this has been such an easy transition. So the resources are out there. But as far as I wish I had more to give.
No, I know it's kind of where we're at, right? But are parents able to go through insurance, like for this age as well?
Oh, definitely. Yes. 0 to 3, though, more than likely, because of those primary years. Parents do go through the government, but after 3, yeah, there's a lot of insurances that are accepting. At 3 years old, your child can go to the school districts, which a lot of parents don't know either. They think, oh, it's 4 or 5, or I have to wait until kindergarten. But no, that school will take you at 3 years old, which is, again, it's public, it's free. So if you wanted to go, through the public school route.
Awesome. That's awesome.
Yeah. And the library is such a good resource. Again, like what you said, if you're able to get there, but even just the book readings alone, having someone else read to your child, and the tracking and the pictures and everything, the environment with other babies and watching and observing. So that's babies pick up a lot, or toddlers pick up a lot from other toddlers, right? From other children around them. So that's huge. That's such a good resource to use.
Yeah. Well, awesome. So our final little thing would just be to ask you if there would be just a kind of encouragement to a mama who maybe just found out, okay, my child does have a speech delay, and now I'm going to therapy twice a week. And maybe they're also going to get physical therapy or occupational therapy at the same time. And as we know, it can be super overwhelming and just feel like, what is happening? So as an SLP and someone who gets to work with families every day, what would be just something, a little bit of encouragement to like a mom who's maybe facing that?
Yes, I understand. It can definitely be a lot at once. Parents may not even know what occupational therapy is, and I don't blame them. I didn't know what it was, truthfully, until I started working in this field. I always tell parents is we don't know the future. We don't know the outcome. I just tell them to be positive that you are exactly where you're supposed to be, and your child is getting the services. You're already in. You're getting the services. We talk about increases if they, wanted to increase. And then I give a lot of SLPs give a lot of parent education, because that's what they need. Teaching them in a kind, passionate way of like, this is okay. Your child's exactly where they need to be right now. You're in the services, and I just we don't know the future, so let's just take it today. Today is all we have, so let's just take it right now. So yeah.
Awesome.
Yeah, that is encouraging. And like what Tessa said, you have such a tender heart, and that shows just in how you're communicating and talking about it, and you clearly love it. So thank you so much for coming on today and for chatting with us. And I learned so much. I was like, as you're listening, I was like, okay, my daughter does this. She doesn't do this. I need to improve this. I'm like, all right, I know what I need. But it's so helpful, and it's great hearing it from someone else. So thank you for sharing, and thank you for coming on. We were so happy you're here.
Yes.
Thank you guys
Kaitlyn,
for
so
helping me
much.
and letting me spread awareness. That's very kind.
Gosh,
I
it
think
was
it's-
wonderful.
It's a super cool thing, and it's just becoming more and more common, like we already said. And it's so neat to hear too that language starts as early as those 3 months. Like language,
First, right at birth.
right? I'm sorry, never mind.
Right at birth. Tessa knows this.
I'm very pregnant, so don't quote me. People quote Kaitlyn, but it's just such a cool thing that as human beings we get to experience language, obviously, and it's such a beautiful thing. And then especially just having that yes, it does. It starts at birth. Shayna. It starts so early, and I think a lot of people don't think about it that way. That it starts so early on. So I love that you made that point as well. But thank you so much for coming on. We are truly so happy you're here and giving us your night, and just again raising awareness, like you're saying, to something that's really happening everywhere. So thank you.
Thank you guys. You're very welcome.
Thanks for listening today. We'll see you guys next week.
All right.
Thanks for listening to another episode of Hey Mama. We're so thankful you decided to join us today, and we hope you go forward in your day feeling encouraged and seen.
Here are a few ways you can connect with our community and support the show. The first way is to share the show with a friend via text or Instagram. You can follow and leave a review on Spotify and Apple Podcasts. And finally, follow us on Instagram at 4MamaBirth.
Thank you so much for listening, and we'll see you next week for another episode.